Hey everyone, thanks for coming. I'm Dr. Wente Liu, and I'm pleased to talk to you today about some of the work we've been doing at Taipei Medical University on non-wearable technology in thoracic medicine. A quick intro about myself and our team. I'm a professor at Taipei Medical University in respiratory therapy and also a physician at Shuangho Hospital. Our research team is amazing, including Dr. Sai Momo, master and PhD students. We've been lucky enough to secure quite a bit of grant funding for projects involving AI, big data, and even Internet of Things applications. Plus, we're collaborating with Wistron Medical Technology, pushing innovation forward together. Since 2021, we've obtained 17 patents covering a diverse range of applications, from advanced sleep monitoring and respiratory health to mental state assessments. Our patented technologies include advanced methods for assessing sleep quality, breathing issues detection, sleep stage monitoring, mental state analysis, and even methods for evaluating cardiac events using sophisticated sensor and computational approaches. Specifically, our patented technologies address critical healthcare needs. We've designed systems for precise sleep quality assessment, methods for detecting respiratory events during sleep, and mattresses capable of identifying sleep stages non-invasively. Additionally, we've developed devices that adjust airflow dynamically to support optimal breathing during sleep, significantly improving patient comfort and outcomes. This time, I'll introduce some of HOM, our researches focusing on developing non-wearable devices for telehealthcare applications. These devices can monitor various physiological conditions, such as sleep-related breathing disorders, heart failure, leading to respiratory instability, and fluid and motion dynamics, which are crucial for monitoring patients undergoing hemodialysis. The first non-wearable application is to detect sleep apnea through radar. We're using radar technology to monitor patients' breathing patterns during sleep. Without touching the body at all, you can see the radar device placed at the head of the bed to measure the ups and downs of the chest wall to detect whether there is sleep apnea. Let's take a closer look at our radar system. It's very precise, capable of detecting even subtle variations in breathing patterns. This allows healthcare providers to monitor respiratory rate, identify abnormal breathing events, even assess the severity of sleep apnea. We're utilizing millimeter wave radar, known for its safety, accuracy, and non-invasiveness. Its application extends from clinical environments to patient homes. This radar system has successfully passed certification processes by the Taiwan FDA as a medical device of counting respiratory rate. In addition, the clinical trial process of Class II medical device for sleep apnea is currently underway, and it is hoped that it will be certified this year. Last year, our research on radar-based sleep monitoring has been published in the Journal of Clinical Sleep Medicine. This study demonstrated that integrating radar technology with machine learning algorithms greatly enhances diagnostic precision for obstructive sleep apnea severity. This has profound implications for patient care and management strategies. We didn't stop there. In a follow-up study, just published on the early 2025, we combined the wireless radar with deep learning to evaluate sleep apnea severity at patients' homes. This study reinforced that such a framework can work outside the lab, accounting for the noisier, uncontrolled environment of a typical bedroom. The ability to do this in home settings is crucial for telehealth. It means we're not limited to hospital or clinic-based diagnostics. We can potentially manage and follow up sleep apnea patients remotely with minimal inconvenience. But we're not stopping at sleep apnea. We're also checking respiratory instability in heart failure patients. Our non-wearable devices can detect abnormal breathing patterns like Cheyne-Stokes breathing and periodic breathing, which can be early warning signs of worsening cardiac conditions. In a pilot study, we used wireless radar and deep learning to investigate the link between abnormal breathing patterns and the severity of heart failure. In Cheyne-Stokes breathing patterns, a combination of one hyperventilation phase and one hypoventilation phase constitutes a cycle length. Previous studies have confirmed that patients with heart failure exhibit a longer cycle length as their cardiac function worsens. In this study, patients were divided into two groups based on a left ventricular ejection fraction, LVEF, cutoff of 50%, representing groups with better and poorer cardiac function. The results showed that the group with poorer cardiac function had a higher respiratory disturbance index, RDI, and a longer cycle length of periodic breathing. Further analysis revealed that for every 1 unit increase in RDI, LVEF decreases by 0.22%, while LVSD increases by 0.14 millimeters. Both are significantly increases according to the RDI elevations. Additionally, for each 1 second increase in the cycle length of periodic breathing, proBNP increases by 158.49 per meter, LVEF decreases by 0.21%, LVED increases by 0.11 millimeters, and LVSD increases by 0.6 millimeters. Moreover, even after adjusting for age, gender, and BMI, increases in RDI and cycle length still significantly affect LVEF levels. We're also applying this technology to patients undergoing hemodialysis. During dialysis, monitoring fluid balance is critical because too much fluid can harm the lungs, and removing fluid too quickly causes cramps and discomfort. For example, before dialysis, pulmonary congestion would cause the rapid, shallow, even unstable breathing patterns. The patient's breathing will become more stable during the dialysis until the intravascular volume under the level to keep adequate tissue perfusion. At that moment, patients might develop hyper or hypotension depending on their compensation of autonomic nerve system. So far, we have found the clues to predict the clinical events before 10 to 30 minutes it occurs. Therefore, the radar system can detect subtle breathing changes, alerting healthcare providers when something isn't right. Again, completely contactless. It's about making treatment safer and more comfortable. We're currently rolling out these sensors in collaboration with hospitals across Taipei Medical University's network: Shuangho Hospital, TMU Hospital, and Wanfang Hospital. We've set up radars integrated with dialysis units and have begun extensive clinical trials involving over 1,600 times of hemodialysis. Our goal is to refine these tools so that soon they'll be standard practice in hospitals everywhere. Looking ahead, we're very excited about the potential of non-wearable devices to monitor not just your physical health, but your mental and cognitive well-being too. Imagine being able to track your sleep stages, assess your mental state, and even detect subtle changes in your breathing and balance. This could revolutionize how we approach mental health and wellness. One fascinating technology we're also exploring is called non-invasive fiber optic physiological monitoring, or NFOPT. The principle of NFOPT is based on detecting subtle disturbances by observing the differences in optical signals as light propagates through straight versus curved optical fiber channels. We know that in straight optical fibers, light travels via total internal reflection with minimal energy loss. However, when the fiber is bent, the change in the angle of reflection causes partial leakage of light from the fiber. Consequently, the amount of light detected at the fiber's end varies accordingly. By analyzing these variations, we can effectively detect subtle changes in shape or position. And here's the best part: NFOPT is incredibly accurate, especially when it comes to measuring your heart rate. It's just as precise as traditional ECGs, but way more comfortable. This opens up a whole new world of possibilities for continuous cardiac monitoring. We're also pushing the boundaries of sleep apnea detection. In addition to detecting sleep apnea events, we're also exploring the possibility of predicting them before they occur. By analyzing ECG spectrograms, we can identify subtle changes in heart rate patterns that precede apnea events. This information could be used to optimize CPAP therapy by adjusting pressure settings in anticipation of an apnea event, potentially improving treatment efficacy and patient comfort. Why can we predict in advance? This is because when our respiratory resistance increases, the body will compensate for it by increasing the level of respiratory work, so that the changes in respiratory airflow will be too subtle to be detected during higher breathing effort. However, such compensation may be manifested in subtle changes in heart rate patterns. Therefore, detecting changes in heart rate, continuous wavelet transform, can be used in this study to detect upcoming apnea events early. This allows us to adjust CPAP settings in real time and ensure patients are getting the most effective treatment. We know that sticking to CPAP therapy can be tough. That's why we're collaborating with a company to develop smart algorithms that encourage CPAP adherence. We want to make it as easy as possible for patients to get the full benefits of their therapy. Non-wearable tech isn't limited to sleep apnea. We're also using wave radar to detect slow-wave sleep, which is the deep, restorative sleep your brain needs to function at its best. During slow-wave sleep, our breathing exhibits a distinct pattern characterized by highly regular respiratory frequency. At this stage, the brain has minimal interaction with external stimuli, resulting in a very consistent breathing rhythm, making it particularly suitable for radar-based detection. In the upper diagram, the green area labeled NRM Stage 3 corresponds to the lower diagram, which shows respiratory regularity analyzed through radar detection. The measure of respiratory regularity is quantified, with higher regularity yielding higher values. It is evident that stage N3 aligns closely with the highest respiratory regularity detected by radar analysis, indicating a strong correlation between these two factors. In addition to observing highly regular breathing patterns during slow-wave sleep using radar or an NFOP system, we can also utilize NFOP technology to analyze the coupling relationship between respiration and heart rate, known as cardiopulmonary coupling, CPC. A specific phenomenon within CPC is respiratory sinus arrhythmia, RS coupling, characterized by fluctuations in heart rate synchronized with breathing cycles. In positive RSA coupling, heart rate increases during inhalation and decreases during exhalation, indicating a relaxed state. Conversely, during stress or anxiety, RSA coupling patterns shift significantly or even reverse, known as negative RSA coupling. Aside from assessing RSA coupling with tools like NFOP-T, which simultaneously measure respiration and heart rate, we have also developed a technology enabling similar measurements through a smartphone application. By placing a finger on the phone's camera to monitor heart rate variations and utilizing subtle vertical movements of the phone caused by breathing when held, we can concurrently record respiratory and heart rate data. This approach allows us to create a simple, personalized RSA coupling measurement tool for which we have already secured a patent. Extending previous applications, NFOC can also be used to measure breathing during wakefulness simply by using a chair cushion while sitting. Our preliminary data show that the signals from the fiber optic G cushion can clearly indicate the state of breathing and events such as coughing. Therefore, for patients with chronic respiratory diseases like COPD and asthma, daily activities such as eating and drinking can essentially serve as a simple test of lung function. If respiratory function is compromised, the breath holding during drinking or swallowing is more likely to trigger subsequent unstable breathing patterns. All these can be continuously monitored over the long term in a non-wearable manner using the NFOP signals from the cushion. To wrap things up, here's what I'd like you to remember from today. Non-wearable tech provides easy, comfortable, and continuous health monitoring. It effectively tracks sleep disorders, heart issues, and fluid balance without burdening patients. Advanced sensors, like radar and fiber optics, will soon be a part of routine medical care, significantly improving patient outcomes and quality of life. Thank you so much for your attention.